Great. I think we can start. We have more and more colleagues coming in. Good morning, good afternoon, good evening, everyone. Thank you for joining this ICPD Talk series, which explores the intersections of ICPD and the Lancet Commission on the 21st century global health threats. My name is Willibald Zeck. I'm the chief of the Program Liaison branch here in New York, and it's a pleasure to be with you. I'm pleased to welcome you to this event where we have our executive director, but also three panelists who are commissioners of this Lancet Commission. Just three quick housekeeping announcements. This event will be recorded so that you know. There's a global icon for Spanish and French. If you need that, you just go to the icon, click on your language, and you can listen and switch over to another language. And there's a Q&A box, and we would like you to ask, and we'd like to ask you to put some questions in while we are speaking, and we can consolidate, and if there's time, we can address them. But without further ado, I'm very pleased to welcome UNFPA Executive Director and Co-Chair of the Lancet Commission, Dr. Natalia Kanem. Over to you, Executive Director.
Well, thank you so much, Will, and greetings, everyone, especially our distinguished commissioners who will be introduced in due course. I have to say I'm very excited about this meeting. We are talking about the future. And with the future comes a sense of hope. Lord knows peace is on our minds. And so it's really great that we're looking ahead. We're looking forward. I also have to say that some of my very favorite people are in this meeting. Our amazing commissioners, people like Fran Kissling, who was an original in Cairo for ICPD 30, our colleagues from IHME in Seattle, and I think Maria Antonieta and so many others are joining our fantastic UNFPA staff, famous for our passion. And we're passionate because we know that we can make the future better, that our efforts make changes. So I'm really delighted to be part of this last of our series, celebrating all the progress since Cairo 30 years ago. And Let's Talk invites us to dialogue. So let me say that we're focusing on the Lancet Commission today, which is looking at the year 2100 as our future point to imagine what are the global threats to health. And what are the interventions that we need to take today in order to affect that outcome? And so this is the brainchild of Professor Christopher Murray from the Institute of Health Metrics and Education, IHME, at the University of Washington. But then we took it further and co-created a really interesting set of ideas, identifying issues, again, with the greatest potential for impact on the health of populations. And our intention is to offer clear and actionable recommendations by the time we're done next year that can be implemented at all levels to mitigate risk. The commissioner's report is going to be released in the first half of next year, if we do our work well. And I've learned so much from hearing insights on the topics of these global health leaders that are joining us here. They're health leaders, they're on the ground, but they're also policymakers at the global level. And this is a time when we need big ideas in order to navigate the change that will lead to the Sustainable Development Goals success. So on the heels of the Summit of the Future, let me quote the proverb of the day, which is that the one who does not look ahead remains behind. If the past 3 decades have told us anything, it's that reproductive rights and women's health should never be taken for granted. They have to be defended day after day after day. And so today, I hope as you're part of this discussion, and we're a big group, so I'm trying to be efficient with my time and to wrap up in a couple of seconds. The agenda, the core of the ICPD mandate is putting women and girls at the center, caring about the adolescent girl and her effectiveness. So indeed, I am really thrilled to be here with Maziko Matemvu, who is Vice Chairperson for Partner Engagement of the PMNCH Adolescent and Youth Constituency, and a powerful advocate for the rights of young people, for the rights of women and girls. And she's going to speak to some of the issues of emerging threats. And of course, we have Professor Luis Guto Galval. He is a senior researcher, very beloved at Fiocruz, and adjunct professor at Georgetown University in Washington, D.C. And he will take us through his expertise, the links between pollution and its impact on reproductive health. And we have Lothar Wieler. He is an expert in global health and digital innovation and had one of the top-rated sessions at the World Health Summit last week in Berlin. And Lothar has agreed to talk to us about how technology intersects with sexual and reproductive health, but also reproductive rights. So thank you, Will, for pulling this together. It's our last and maybe our best Let's Talk of the year as we close out the ICPD 30 series. And again, for my colleagues and for those of you who have joined beyond UNFPA, please let us hear your views and make this a great discussion. Over to you, Will. Thank you.
Thank you, Executive Director. And the introductions have already been made. We have 3 of 30 commissioners that we have on the commission, and they're very esteemed ones. And I just want to go into the first questions that we have, and I will start with Masiko. Masiko is the vice chairperson of PMNCH, but also has started an NGO called UWALE, a youth and adolescent focused NGO. And so, Masiko, I want to turn to you. The ICPD Program of Action affirms youth, and we in UNFPA are very supportive of youth, as you know, very passionate about it. And you have this excellent experience in human rights, international developments, and you're a tireless advocate of youth. Of all the deliberations of the commissioners to date, what specific threats do you feel are the most pertinent for youth in the future, and as we speak about the Commission in the next 100 years? Over to you, Masiko.
All right, thank you so much, Will, for that question. I should say it's a very difficult question to really zero in, but a very important question as we dive into today's discussions. I first of all wanted to start off by saying that there are 1.8 billion adolescents and young people in the world today. It's far more than ever before. And it's very clear that a thriving adolescent and youth population yields social, economic, and health benefits for all. Yet for far too long, their needs have been largely invisible. My reflections today would draw from experiences on the ground and also echo the 1.5 million voices and 1.5 million voices of adolescents and young people from the Global Forum for Adolescents that happened about a year ago, and also echo reflections from the world's largest survey for young people called the What Young People Want campaign, which brought together adolescents, young people, and policymakers, as well as advocates and allies from around the world to really discuss issues that affect adolescents and youth globally. So thank you again for emphasizing the need for youth involvement and development. And as we consider the current threats to young people, 3 areas for me stand out. The first being sexual reproductive health and rights, mental health, and climate change. Obviously, that's a lot, but I'm just going to quickly share my reflections on why these stand out. I'm going to start with climate change. So from extreme weather events to slow onset environmental degradation and rising temperatures, the effects of climate change have a disproportionate impact on women and girls, including on their sexual reproductive health and rights. And heat and climate-related food insecurity have a detrimental impact on maternal and child health outcomes. Whilst natural disasters may limit access to essential health services, including reproductive, maternal, newborn health, as well as adolescent health services, especially for populations in vulnerable or marginalized situations. Climate change also creates conditions such as forced displacement or a loss of livelihoods that are associated with increases in gender-based violence and harmful practices such as child marriages. And furthermore, the psychological burden of climate change contributes to eco-anxiety affecting young people's mental health. And speaking of mental health, the mental health of young people is at a critical juncture. The rise of social media coupled with societal pressures and economic uncertainties has contributed to the increasing rates of anxiety, depression, and other mental health issues amongst young people. The stigma surrounding mental health care often prevents young individuals from seeking the help that they need, and prioritizing mental health initiatives and providing accessible resources and integrating mental health education into schools are essential steps to supporting young people in this area. And finally, to just zero into the sexual reproductive health and rights, in terms of SRHR, many young people still face barriers to accessing essential services and education. This lack of access can lead to unintended pregnancies. Actually, it does lead to unintended pregnancies and health risks, particularly among young women who experience additional challenges due to gender inequality, limited access to comprehensive SRHR services, and many young people, especially in marginalized communities, still face significant barriers in accessing essential SRHR services, including contraception, safe abortion, and maternal health care. And this lack of access leads to higher rates of unintended pregnancies and sexually transmitted infections, impacting their health and life opportunities. So with all this, it goes without saying that the realization of sexual reproductive health and rights, and their ripple effects on education, income, and gender inequality increases the resilience of women, children, and young people to accessing and strengthening essential health care for young people. I think what's interesting about all these threats for me is that they're all interlinked if you look closely. And for me, and being part of the commission is also exciting because I think it really challenges us to really go beyond the health sector and see how multi-sectoral collaboration can be at the center and the heart of our initiatives to ensure that young people, and especially those that are left behind and the most marginalized, are at the center of all discussions and are really the drivers to the change that we want to see. Thank you.
Thank you, Masiko. I think very interesting insights. You mentioned mental health. And I think this is exactly why you are part of this commission, because you bring the youth perspective. And that's so important because, we have global public health experts, and as we see from Lothar and Guta, as they will speak later on, they have expert opinion, but you have the youth perspective. And as you said, intersectionality is very important. In the mental health, I think artificial intelligence and technology and young people being in the virtual world now is maybe the lead way to our next speaker, Lothar, because Lothar, you are the chair of the Digital Global Public Health Institute, the Hassner-Plattner Institute, and you deal on a daily basis with artificial intelligence technology, and that's also the expertise you bring mainly to the Commission. Since the ICPD agenda, Lothar, was realized in 1994, we have seen technology rapidly advancing, and AI is coming in a pace that we cannot even follow. We don't even know where it's going to take us. And you work at the Hasso-Plattner Institute exactly on those issues, artificial intelligence, but also looking at the benefits, but also the threats. And as we speak about threats in the Commission, can you elaborate a little bit, what does it mean for health, and how can we safeguard the rights for individuals into the future? What are the harms, but also the potential benefits of artificial intelligence and technology? Over to you, Lothar.
No, thank you so much, Wilbert. Thank you for having me. It's a big honor to be here, and it's also a great commission, and I also learn a lot. Great people, great ideas, very open discussions, and that's what we need because we have to solve some real issues. So I thought, first of all, I'd like to tell each and every who is listening that I'm absolutely convinced that artificial intelligence is really creeping in each and every part of our lives, and it offers huge chances. It offers huge chances if we properly display it and use it. However, I think that we will not be able to really make the best out of it if we're not aware of the risks. I'm always convinced that you have to look from the perspective, what are the risks? Because if you have those in your mind, you will more ethically and morally soundly roll out these particular applications of AI. And I just list some of the risks, and we can then talk about how we salute this and challenge them, basically. So the biggest point, and this has been mentioned by various authors and groups in the past, is the misinformation and disinformation aspect. I mean, this technology can be really used to develop a lot of very convincing misinformation. And I think you are all aware of many of those. Nowadays, it's really hard to know what kind of information in the news, be it political information or be it information, if you think about the COVID-19 pandemic, that caused people not to take up a vaccine, or that, if you may remember, particularly in the United States, all these rumors about therapeutics that never worked out, like ivermectin even causing death. These are all misinformation, disinformation, which can be not only scaled up tremendously by AI, but the quality of the information, particularly when it comes to pictures, which is very, very informative. Pictures, seeing pictures from people, seeing situations, looking into obvious situations. This is something that we really have to take care of, and it's a huge threat to my understanding. The second issue, when we talk about AI, it's obvious that AI is based on training of large data sets, and this is the strength of it. On the other hand, obviously, it's also causing safety and security issues, because who takes care of the privacy of these data sets? This is a huge issue that we always have to have in our mind, and therefore it's of particular importance that the technologies that are currently owned are mostly controlled by private entities. I mean, it's a big companies that control these issues, these private entities, and there are various concerns in what direction this goes and how you can protect the data from people, and, for example, how you can protect that the rights on this data, which have been published by other people and generated by other people, how they can be really safeguarded. Unsafety and insecurity will also be a huge issue. So this is obviously AI. There is a security threat. Something that also comes into your mind when you're looking about the technology of AI, surely all the analysis is based on algorithms, and obviously algorithms can produce errors. So if you think about the outcome of those black boxes, for example, in medicine, and you have clinical decisions made up by algorithms that you don't even understand, obviously errors may lead to incorrect diagnosis or treatment recommendations. This is something we should also be very aware of, because the more we rely on artificial intelligence, which obviously will give us better decisions to make, particularly in a clinic, for example, in a hospital, or whenever it comes to treating people. On the other hand, we shouldn't lose control over these data and the algorithms. One issue that is particularly prone to the topic that we are talking about, reproductive health or health as such, is the bias, obviously. I mean, you know, AI algorithms tend to be unbiased. However, the models are based on training data, and obviously, most of the data that currently are trained by the big companies are data from the global north, particularly from the United States, from Europe. But there are, you know, so many vulnerable groups, so many groups, minority groups, which basically don't even find themselves in these data sets. So there's maybe a huge bias in the algorithms that are developed. And you may also recall some of these biases, for example, when it comes to measuring certain diseases, or measuring certain factors of clinical factors by training data just on white men. Obviously, women fall back when you use the same algorithms the outcome of the treatment will be worse. This bias can be tackled easily, but it's a daily business, to be very frank here. Another thing that is more a societal issue is obviously as AI-based decision support systems or systems are very much prone to cause automation in various areas, obviously there will be job displacement. The jobs will get lost. And this is something we also have to think about very carefully. Which of the jobs do we want to be displaced? Which of the jobs need to be strengthened? A lot of jobs can be automated, which is nice when you look about healthcare tasks, for example. On the other hand, obviously, the healthcare workers need to have their role, and we have to find a social contract with this. This is also really important. And then, of course, we come to a topic that I think everybody of you is thinking about directly, the digital divide. Obviously, while, for example, in many countries in Southern Africa, for example, or Sub-Saharan Africa, many people have access to smartphones. Obviously, they don't have access to the data. And we don't have enough data to get trained them for their certain problems and issues, because we all have this problem that the data are from the global north. So this digital divide with AI, the chances that this digital divide is even getting larger, is increasing, is huge. This is something we have to take into consideration. Mistrust is an outcome of misinformation, and you know that even state actors from particular countries, not only private people, but often state actors, directly influence the decision-making of people, of societies when it comes to elections, for example. And they do it by with a clear goal to really put distrust in societies and weaken other societies that don't think in their undemocratic way. This is something, there a lot of money and resources goes into this particular mistrust setting. Bioinsecurity, that's another issue that I wanted to touch. We are all very, I would say we're really happy and actually excited about the evolution of AI. But also, if you look at synthetic biology in combination with AI, it has never been easier to produce possible bioweapons like it is now, because synthetic biology and AI make a huge leapfrog development. And this is something where we really need global conventions to tackle this. And lastly, something I touched already a little bit, the intransparency. You know, how can you understand algorithms if you are not really educated enough about it? And there we come to one of the most important conclusions, which holds true for most of the issues we are talking about. Sound education, obviously. Sound education at a young age still is the best prevention of many of those things. If we understand AI, if we are able to describe what goes on, how algorithms are set up, what they are trained on, that's the best way really to prevent many of these critical risks that I listed. And again, I listed all these risks. However, there are many, many chances. And I'm confident that if we have these risks in mind, we can bring AI really to power and to make the world a better place. That's from my side.
Thank you, Lothar. Very fascinating. And you're saying it's still an algorithm, but sometimes when you interact with AI, it looks almost as if a person is on the other side, but you're forgetting there's an algorithm behind that, and it can be manipulated. Very fascinating. I'm sure I want to encourage the participants to post questions. There's already a few. Also wanted to say we have 100 plus participants, which is great because this webinar was on a short notice. And we have also in the audience renowned experts. And I want to acknowledge Marge Beerer from the UK, who also has joined. So thanks for, even from other parts of the world, for you joining and being very interested in this Lancet Commission. Lothar, thank you. We'll come back to you later with another question. And I would like to now turn to Professor Luis Galvao, or Guto. So Guto, thank you for joining us. You are, as our executive director was saying, a senior researcher, but also adjunct professor dealing or looking into pollution, environmental health, and the link between climate change, pollution, and health. And you are the expert on the commission for that. And you have been looking at the impact of pollution and climate change on the world around us. In the Lancet Commission, you have looked at specifically health in the next 100 years. Can you speak about the pollution and its impact on health, and probably also more specifically on reproductive health and what that means for us? Thanks, Guta.
Thank you. Thank you very much. Good morning, everybody. Good morning, Karen. Good morning, Albert. It's a pleasure to be here. This issue of pollution and reproductive health is maybe the main issue when you talk about toxicology. I am a toxicologist by training, so when you look into pollution, the first thing you think is this affecting the reproductive health in terms of generating some problems in the next generation, or generate some problems for the mother or for the child? This is the biggest question, because this is the most important question when you talk about any pollutant and any kind of problem you might have. So reproductive health and toxicology is linked together, and for long standing, for a long time. It's an essential part of regulation. If you look for any pollutant that's regulated in the US or any other country, this is an essential part that need to be considered for that. And this is something we are looking to the commission when we talk about the pollutants. Always we talk about, how much that's affecting young people, reproductive health, and next generation. This is a big issue for us. This is the direct effect of pollution, but we already listened from Maziko all this climate change, what is happening, and how is affecting young people, and how is affecting reproductive health, because doesn't all the effects of climate change is avoiding people to access services, is making people more vulnerable. And I want to make a special case here for the people who are more exposed for the elements, like the homeless. They are more exposed for that, including young people and including women that are exposed for that condition and suffer the most. But also those that are the immigrants, which many times are more exposed for the climate change effects, and also the other the workers that are working in the environment, in the open environment, also is more exposed for the elements. And many women and many children in some parts of the world are affected for that. So we see today we are understanding more and more, including with the help from what Lothar already says, the AI and the training of models. We are understanding more how these things is affecting health, and particularly the health of women and vulnerable population. In the commission, we examine some aspects of that, and I have been the privilege to organize the information and bring that to the commission. We look into the air pollution. That's one of one of the biggest threats we have today. Is listed as one of the bigger killer of environment by the WHO. Is considered one of our most important problem. But it's something that people are taking action on that. So even air pollution is very important, and it will be for a long time.
Oops, Guto, I think he's frozen.
There are a lot
Guto,
of...
You're back, so you were frozen. Please go ahead. Yes,
okay,
sorry.
So sorry, maybe my connection sometimes. But the air pollution is one area we examine as an area of concern, but it's an area where we see there are a lot of actions, or at least awareness about that problem. So, but still is a big problem, and is something we are always examining and talk about that. The second one is chemicals. So chemicals become a big problem. We have the lead is one of the child problem we know the most, at least in the US. We all know about the problems we have with lead and how much that being neglected affect the intelligence level of the young people and affect the next generation also. But there are others, like the plastics. Plastics is a new pollutant today. The microplastics, which is the way the degradation of plastic becoming smaller and smaller, now has been detected in the human body. So, and that's something is new, is there, will be there for the future, because plastic take centuries to be degradate some of them. So we really is a big concern, is looking to this kind of pollutants. That's a new pollutant and is out there. The other area we take a look is all the electromagnetic field. We don't have at this point any detect effect of that in general, but it's an area we are more and more surrounded by electric materials and electric active equipment, and they will leave with that. So that's another area we also took a look on that. The other area that's very important for maternal and reproductive health is endocrine disruption. So there are some elements that mimic some of our endocrine system molecules, and that affect the way our organism operated, affect the way we regulate our organism, and also affect the way some of our fundamental physiology can act. So this is one of the important aspects we also take a look, and how much of all this substance we are in contact every day is actually taking having some kind of impact directly on the or physiological mechanism in the body. So basically, this is the direct effect we are looking to that. But there are many indirect effects. Maziko already mentioned all these intensification of climate events because of the climate change is generating more challenge for our health system and for our cities. And we've seen now a lot of problems we didn't see before. This year in Brazil, we have three important phenomena. One is a big draw in an area we haven't seen that in that amount. Wildfire, at the same time flooding in the south. And this is a combination of different aspects. One is in the case of flooding is a urban health problem, because the urban infrastructure wasn't prepared for that. And also, the operating regular times, they have this schedule of doing maintenance every 15, 20 years. Now they need to update that and do every year, because we see that's not taking care of that, but also need to be updated. The other is the whole health system. We see the health system, when crisis starts, is the first one who is affected, and the results of that and all the impact on that is something that takes years to recover. And this is another important element. And the other is the invisible effects. Mental health is one of them. We don't really fully understand how that's affect, but we are seeing that in the practice. And all people in the front is saying, this is getting worse and worse and worse, and is affecting more and more young people. And this is a message we are getting, and we need to understand that better. So this is one of the indirect effects. But the others are the long-term effect, because once you displace people by these big events, and people become part of other realities, they have a difficulty in adapting for that. They have consequence for their health. And this long-term effect in that generation, but also in the other generation, is something we are still learning. There are studies done in the Katrina area, studies done in the Gulf area because of the horizon. So there are many studies trying to understand the long-term effect of this kind of wave of caused by one disaster or one big disaster. So That's it. So there are very specific effects in the body. So coming from toxic effects to disruptions, there are indirect effects of air pollution and other that causing us problem, and there are these long-term effects, and this is what we are discussing in this commission. And we have a long way to go now to come up with some synthesis, as Natalia said. Thank you.
Thank you, Guto. Fascinating and interesting to hear. But normally one would think pollution, the first thing you think is air pollution, but the plastic particles you were saying can mimic hormone-like endocrine particles, and that could have also an impact on reproductive health systems in terms of hormonal changes, I guess, right? So it's something we don't know yet where it's going, but plastic is a big issue, as you were saying. So really fascinating. Thanks, Guto, for that. Meanwhile, we have great interest from the audience, which is really what we wanted. And we have 3 questions. So I think what we do now is we take these 3 questions and pose it to our panelists. And Lothar, I think there's one question for you. Our audience today is, of course, UNFPA, but we have also our dear colleagues from civil society with us. And the question is how can we guide governments and civil society to address the challenges of the AI gap in their countries? And I think you spoke to that in Berlin. Some low-income countries are looking into AI, I believe, to see how they can get the health worker gap, how to overcome it. But maybe you can elaborate on that, Lothar.
Yes. So I guess that with the AI gap, the mention is that in some areas there is a lack of AI. I guess that's what behind this question. So obviously, I mean, most important, obviously, you have to bring electricity to the places. That's for sure. And change the living conditions that there is on a community level the chance to get hand on this on AI. Something that we discussed in Berlin is basically it's from the local to the global. So we know that there are these huge companies, and we all agreed on basically without these huge companies' support and involvement, it will be hard to make the reach out. So basically, the amount of technology, the amount of data, the amount of electricity and everything is huge. And if we do not empower the communities and the areas where AI is not around, if we don't empower them to be able to sample their own data and to analyze their own data, we will not be able to make a difference. This is something we have to empower them with all the means that all of us are aware of. And the second issue that we touched is obviously we need to make people knowledgeable about AI, about the risks and chances of AI. How could we ever implement a technology that people are afraid of, that people don't know what we are talking about? And this is the hard part here. And when you ask about politicians and governance, what we see over the last years or so is a diminished acceptance of various political leaders of scientific background, of scientific facts. So this is something that we really have to dwell in a lot in many countries, that we stay scientists, what scientists are developing needs to be crucially interpreted and needs to be crucially taken into consideration with all the cons and pros, but we can't let political decision makers from the hook that they basically do not accept certain technical issues which are like they are. So we need both to empower communities, and we need to make clear what AI means for a society and how a society can really profit from it. Without this, and there I come back again to the most important issue, which is education, and good living conditions. Obviously, it will be hard to not get totally unfair usage of AI for certain parties of our global community. this is something we really have to be very keen on, because it's moving ahead so fast. We have to be very, very critical and have our eyes on this.
Thanks, Lotus. I think you were saying AI can be an equalizer, but it can also increase the inequalities we see across the globe, across governments and nations, right? So we have to get this right. And I think this commission is exactly looking at that. So thank you, Lothar. Very, very insightful. I would like to turn to Masiko, and there was a question on mental health, and the mental health obviously is an issue that Guto has mentioned, and you, Masiko. And the question is, whether you could comment a little bit on the barriers regarding parenting and adult centrism, and what programs we can offer in terms of psychological services to adolescents, especially in the next 100 years, or as we look as the commission into the future.
All right. Thank you so much, Will, for that question. And I think my response will pretty much be an extension of what Lothar has just mentioned. And I think the most important thing is really the need to educate communities and to really work with communities, not just as beneficiaries, but as partners as well. And I think we're so fixated on young people and adolescents, but we really need to realize that young people and adolescents, they exist in an ecosystem. There is a saying that it's an African ideology that I really love, and it pretty much says ubuntu ngumuntu ngabantu, and which pretty much means that a person is a person through other people. And essentially the idea here is that it takes a village to raise a child. And when you are thinking of approaches, we really have to think through like socio-ecological contexts to really get to really advance the health and well-being of adolescents and young people. And here to say what has worked in communities is, for example, like I mentioned, number one, working with parents, not just as beneficiaries, but as partners, and meaningfully engaging them, ensuring that they are part of all the processes in terms of conceptualization, programming, the framework, implementation, that they are a part of it, and that we're not really imposing ideas on them, but working together with them. And what I have seen is that they start to change their mindsets. And I think we really also have to consider using parents as champions and really tailoring trainings and manuals to really support them to become these champions to change mindsets in communities. So, for example, I know the SADC Secretariat, when we're trying to reduce new HIV infections and increasing ART adherence, but then also advancing the mental health of adolescents and young people across Africa, one of the things that we did was using media. So using radio programming, but then also using animations, using drama and poetry to really just connect with the parents so that they are able to really understand how they can be part of the change. But then essentially working with parents as partners. Number two, working with them as champions so that they're championing the call to actions and the agenda. But really working with them as partners is such a game changer, because even when you leave, you have to think of sustainability. That once your intervention, you've left that community or that institution, are the things that you've left there, are they going to sustain? Are they going to be sustainable? And to ensure sustainability, they really have to be engaged as partners. But it is possible, and it does work, and it is a huge challenge. But I've really seen parents change their minds, traditional leaders change their minds, religious leaders change their minds, only because they're being meaningfully engaged.
Thank you, Masiko. And it's also, I think that sometimes parents cannot understand the biology or even the basics, and that could be a problem. And then also we have legal frameworks, I guess, where adolescents can legally marry at one point, but then don't have consent, need consent for contraception. So a lot of challenges, but it's, I think your insights are really great. Also for the commission, and we have seen this in the last commission meetings that it's so great to have you to bring exactly that. That's really, and thanks for your insights. Guto, I have also a question from you from the audience, and it's more about the commission itself. There was a question how we work interdisciplinary. Do we take an interdisciplinary approach in the commission, and how does it work to understand the threats, and also linked to that, how we deal with marginalized population? What is the intersectional approach to that? Maybe you can answer that. I believe the commission is well suited for that because it's different experts, but maybe you want to allude on that.
I can start, but I'm sure the others have also to say that. I think there are one question, it's very important in the environment today. We are learning the process of interaction between events are not linear, and there's not only one. So it's not the disaster lead for mental health and then lead for a consequence. It's more than that. It's disaster lead for a series of things that interact between them, and then leads for a series of second things that interact between them, and then finally you get something that's mental health. And so these complex systems, we need to build more, or maybe rebuild or understanding our system. And this is the beauty of the commission, because a lot of talk about this big data, AI, model training, algorithms. This is all being used to understand these other things like mental health, how that's interact, how that have to do with climate, how that have to do with system. So it's this kind of new understanding of the system as a complex system is a big challenge we have today in the environmental community itself, but also within the commission. So that's one thing. And building on that, you also are looking for solutions that can embrace and can actually respond for that. And the solutions cannot be a linear solution, cannot be only, so let's avoid air pollution. That's great. But how you do that? You need to have a policy in place. You need to have a different, system of communication, because communication today is part of the solution. Rather just say about, all this problem of using of the information. Access to information is another issue. Training, understanding what that means. So all this need to be redesigned, and we need to have a different way of looking to that. The Commission are looking into that from the philosophical point of view, but also from the governance point of view, and that this might be one of the best contributions we can give, is how we can better understand complex systems and how we can govern complex systems in a different way that's more effective, and use all these wonderful tools we have available today for us. In terms of environment, this is essential. We are increasing our capacity to monitor using satellites and having more precision and having better models. How we integrate that all, to make it available to the prediction of disasters, and how we act on that, and how we need on that automatically. So that's, for me, is an essential part. And it's the beauty of the commission. I have been in very interesting conversation, like put together vaccines and climate. So how much more vaccines you need, and which kind of vaccine you need, that going to the technology of production of vaccine, and how that have to do with the climate effects. So that's connecting these two words is a big task, but it's a very important one, because connect two very complex and independent fields together, and bringing a more systematic and more complex systematic view of the reality, and a more complex and systematic view of governing the reality.
Yes, and Guto, there was just one comment. Of course, the human rights-based approach is very central to the Commission, correct? interdisciplinary look at human rights.
No doubt about that. So there are some principles. And we have a very good chair. Natalia Kerr is there, and she always, bring that all the way. So it's a strong anchor. It's a strong anchor. Everybody in the commission is very, let's say, linked and believer of that principle, and this is essential for that. Not only human rights, but also equity, and also the promotion of collaboration, and the promotion of fraternity between all the different sectors and all different populations.
Thank you, Guto. And just to say, Richard Horton had warned the Commission that the discussions will be rather light in the beginning of the process, and interdisciplinary approach will be interesting. But as you come further to the report and it comes to the details, this is where the real discussion is happening. And I think we are currently at that stage, right, Guto? So, and the discussion is being continued. Great. Thank you. I just want to turn to you, Lothar, just one or two words. We've been a bit negative here in terms of the threats and so on. Is there something positive that you see that we can look forward to, just in 2 or 3 sentences before we close?
In general, or regarding AI?
In general, for the Commission, probably some optimistic outlook, so we end optimistically.
Obviously, we never had so many tools in our hands with which we could lead all of us into a better future. I mean, we have all the tools. We have enough food, we have enough resources, but obviously the way they are distributed is really, really, really inequal. So we have the tools. When it comes to climate change, which is one of the big threats for health and for many other areas, obviously, we know how to mitigate it. We know how to do it. We have all the recipes, and we just have to do it. And therefore, I mean, this is something, again, this is not only my pledge to politicians, which have a huge power here and a huge responsibility here, but also civil society, obviously. But here the issue is that we really have to understand the magnitude of the problem so that we really mitigate it. And this is something that we always should keep in mind. If you look at the world currently, you're looking at all the wars, civil wars, and all these disasters. Most of them, I don't know how many percentage, we should calculate it, by the way, in the Commission, most of them are made by men, which is pity, which is absolutely disgusting, and I really despise this. However, it means as we are causing these problems, it's also us who can really bring the solution. This is very easy said, but hardly done. Yeah, we can do it.
Thank you, Lothar. Sounds very optimistic. This is what we wanted, because this Commission is not about listing threats. It's also about having an optimistic outlook. Thank you so much. I would like to hand over to our Executive Director, Natalia Kanem, for some closing remarks or some comments that you have. Over to you.
Yeah, not really to close. I think the conversation continues. That's been our theme for ICPD really since Cairo, that politics matters, putting women and girls at the center matters. Everything that's been said today underscores that racism and discrimination and people are being left behind, even though we have the means to do better. Why haven't we conquered maternal mortality, for goodness sake? It's not that hard, but political will makes a difference and resources make a difference. I also thought, listening to everybody, and Maziko also alluded to, we're in an era of demographic diversity. Lulay Shabane, one of my demographer colleagues, makes that point in the Q&A. So is this going to be used as polarization, or is it going to be a point of unity where orderly migration actually benefits countries with low fertility? Similarly, women are voting. They're voting in the polls, but they're also voting with low fertility. And this is an issue of gender disparity and power dynamics. So at this point, whether it's true, and I think we need to tease this out and engage with young people, many young women are saying, I'll sacrifice my fertility for the environmental benefits of the future generations, right? Our analysis says that that is not a linear relationship. But young people are passionate and they believe and they're, trying to do their best. And I think as we looked at the Summit of the Future and those products, the Pact of the Future is accompanied by a digital compact, which for the first time gives us a shot at having some reins on the process of global governance of artificial intelligence and things like that, which should be of huge benefit, but they are in private hands, as Lothar mentioned. And I also think that the Pact for Future Generations really emboldens us to be able to think through some of what Guto put on the table vis-a-vis these pollutants are not just this generation, they're penetrating into the future. This commission was critiqued, shall I say, as we began, because we're looking to the year 2100. And of course, there's so many variables moving forward. But we think that there has to be an antidote to short-termism. And issues of peace are very fundamental to our ability to have a public health, to be able to have a public health service, to be able to listen to local insights, and to be able to move forward. So I hope that this discussion doesn't end here. Next year, for Beijing 30, I hope that civil society will again join us and be vocal and visible in demanding fairness and equity for women and for all genders, as a matter of fact. And UNFPA will certainly be happy to do our part. But delighted to have been with you. And thanks again to the commissioners and the participants. And back to you, Will.
Thank you, Natalia. Thank you, everyone. This was it for today. I hope you were excited as we are about this. This is really new insights, and it just is important to look to the future. And 100 years is important and very interesting. Many of us will not be here anymore, most of us, but our next generation will be there. And that's why folks like Masiko, commissioners, are so important. Thank you to our three wonderful panelists for the fascinating insights. Thank you for the engaged audience. You really posed questions, and I thank you for that because we were worried, but there are many, which means you're really engaged. Thank you to our civil society partners. If you want to follow the Lancet Commission and you want to watch the space, look out for the final report that will come out middle of next year. Stay engaged. Let's stay engaged on a conversation, and let's use this for the wider ICPD. I wish you a great week ahead, successful days ahead, and the weekend is not so far away, so enjoy that one as well. All the best to you.